So today I want to talk about platelet-rich fibrin. Platelet-rich fibrin is where you first take someone's whole blood, put it into a vacutainer, spin it in a centrifuge so that all the layers separate. The layers are red blood cells, and then a second layer that includes fibrin, platelets, leukocytes, monocytes, and a couple of other things. And basically what you're trying to do is you're trying to get rid of all the red blood cells and create a concentrated solution of this fibrin, platelets, leukocytes, and monocytes. Once you have that concentrated solution, you can put it in a syringe and you can inject it into an area. And when you inject it into an area, the benefits are tissue healing, pain relief, and regeneration. It literally regenerates tissue. So platelets are full of growth factors, and when you put platelets in an area, it pumps out those growth factors to heal an area. Now, PRF is a pretty new method of concentrating platelets. The old method is called PRP. With PRP, you would spin a solution and you would get a serum layer, and you would get what's called a buffy coat, which was platelets, and then you would get red blood cells. And now the problem when you created this PRP was, you see how you have the serum, the platelets, and the red blood cells? Well, also in those red blood cell layer, you would have the fibrin and the monocytes and the leukocytes and all the other really good cells, because the spin was too hard. But then some people came along and they discovered, oh, you spin it a little bit slower, you can actually get this top layer here that has all of the good stuff in it, more distributed evenly. And then you have red blood cells, which you don't want. So when you have that even distribution of all the good cells, now you can inject it into an area and you can get even better growth, better regeneration. The reason is because with PRP, you inject the platelets concentrated in plasma, and within about a couple of hours, those platelets are going to get washed away, they're going to migrate out, they're not going to be there. They're going to pump growth factors for 2 hours, right? But when you have PRF, platelet-rich fibrin, the fibrin, that component actually creates a clot in the area where you injected it, and it traps all the good cells, the platelets, the monocytes, the leukocytes. And when they're trapped, they can stay there for days pumping out the growth factors, and that's really what you want. So let's say you have, just for example, a tear in your rotator cuff, and you want to heal that tear. So you diagnose the problem, you go in with this PRF solution, you inject the PRF into the area where there's a tear, and once you inject it in a liquid form, it takes about 15 minutes to form a clot. When you inject it in the liquid form, it's going to clot up in that area, trap all those good cells, and they're just going to pump growth factors, regenerative factors in that area for days. It's so powerful, and it's a very effective treatment. You can use it for facial regeneration. What a lot of people don't realize is that fine lines and wrinkles are literally your face degenerated. The architecture of your face, the architecture of your skin, the collagen in your skin has degenerated, just like arthritis in your knee. And if you want to regenerate it, you have to combine something like this, some type of growth or regenerative healing solution with an initiation of the healing response, like a needle going in, some type of assault that initiates the healing response with the good solution. Used for arthritis, degenerated joints, tears, meniscus tears, pretty much anywhere in a joint, a ligament, a tendon, or just tissue like your face, where you have some type of degeneration or injury. That was it.
Sweet.